Hi, everyone. This is Jim with JP Reacts. This is where you come to see a former candidate talk about what politicians are saying and what they're not saying in their speeches and comments in the public. So, today we're going to be looking at a news report from NBC about how President elect Biden plans on getting the vaccine for COVID distributed. If you're interested in that, stay tuned after this. Okay, so we're going to jump right in and see what this news report is going to be saying.
Joe Biden could use a wartime law to fight the coronavirus pandemic when he becomes president in 29 days. NBC News correspondent Heidi Przybyla exclusively reporting that Biden aides are talking about using the Defense Production Act to get vaccines out to the public. President Trump used that law to speed up testing and produce.
The Defense Production Act has been in the news a lot, especially back in the spring. Democrats were wanting the President Trump to use it to help build more ICU beds and build more ventilators and masks and all those things to try to get things going. He didn't really implement that. He did do it a little bit for the chemicals that go into the vaccines, but he didn't really do a whole lot with the other stuff that was in need early on in the pandemic. So that's kind of where we're going with the Defense Production Act.
Medical supplies. Heidi joins me now. Heidi, for our viewers who are not familiar with it, what is the Defense Production Act and how seriously is the Biden team considering using it here?
Hey, Allison, that is a Korean War era Production Act law that was created to help the government compel manufacturers in the U.S. to produce things that are in our national interest, in our defense interests. And so the president-elect is looking at this as something that could possibly help us scale the vaccine production early in the new year. Here's the bottom line, Allison. We're being told that we're going to have this mass vaccination campaign in spring or summer. And yet I'm told by senior Biden aides that the supply just isn't there yet. Not that it's not going to be there yet, but it isn't there yet. And that we have these negotiations going on, for instance, with Pfizer. We have two different pharmaceutical companies, Johnson & Johnson and AstraZeneca, which are expecting critical trial data to come in right around the time that the president-elect is inaugurated. And that means at that time, he's going to have some options about what levers to pull in order to scale up as quickly as possible. Now, the big concern here is that we not do this in a way that favors one pharmaceutical company over another. That is not an easy issue to get past. But when we have more information in January, Allison, for instance, let's say Johnson & Johnson comes back. They have a really great.
Before they get into too much of which vaccine is going to be distributed and when, the reason that they're even considering this is a lot of people need to be vaccinated really quickly so we can get the economy rolling again. And right now, the Trump administration doesn't really have a good plan in place to really roll that out and ramp up production for the vaccine in any of the cases. There are two currently that are available, one through Pfizer, which they mentioned, and the other one through Moderna, I think is the name of the company. Both have been approved by the FDA for emergency use. And what the Defense Production Act is going to do is basically compel these companies to mass produce this and take over to make sure that they are required to use all their resources to produce just this vaccine ahead of any other medicines or whatnot that they're making. And we need millions and millions of vaccines produced quickly, not just for this country, but then also for the rest of the world too, to be vaccinated. I know there's a lot of other vaccines that are being pushed throughout Europe and in Asia and in the Middle East and in Africa, and we really need mass production of this, not just in the United States, because as we know, this didn't start in the United States. It originated in the East and then came to the United States through Europe. So we really need to make sure that we not only vaccinate hundreds of millions of people in the United States, but billions of people worldwide, because just because the United States is taken care of doesn't mean the world won't be and won't continue to be a problem for the United States moving forward. So right now they're going to be talking a little bit about how to balance, since there are multiple vaccines with multiple companies, how not to favor one company or over the other. At this point, hopefully it's not the biggest concern. The bigger concern to be actually who can make this the fastest. So let's see what they have to say.
Vaccine, it can be given in one dose, effective, done. There may be some discussions about, do we ask a company like Merck, which has some of the specialized components that could help us scale, to jump in here? Do we have to use the Defense Production Act to do it? I could go on. This also applies, for instance, to syringes and needles, where we may have shortages. Again, getting to that herd immunity effect in the spring and summer.
So that's also important. Obviously, it's not just the vaccine itself, but the distribution of the needles and the syringes. And when she was mentioning Merck, who doesn't currently have an approved vaccine, what she's saying is the Defense Production Act can be used to take, say, Pfizer's vaccine and make Merck compel Merck to produce Pfizer's vaccine. So that's why she was referring to another pharmaceutical company, because this act allows the government to direct both Pfizer to give Merck the chemical makeup of the vaccine, but also Merck to produce the vaccine themselves. So that way, multiple companies are producing the vaccine to move them forward. So that's why she mentioned Merck, but also there's the distribution of the needles and syringes and all the stuff that goes into making sure that we can actually deliver the vaccine. Because just having vials of vaccine sitting in a doctor's office isn't helpful if there's no way to get it into the arm of the patient. So let's see what's next.
Heidi, what do we know about the range of options the Biden administration has? Are they really aware of all of the options on the table? Or are they still trying to figure out exactly how they can handle it, whether it's the Defense Production Act or going another route?
So much, that's a great question. So much is going to depend on what comes back in this trial data and what it tells us about the efficacy of these other vaccines. And what's more, also Pfizer, right, is pushing for us to use the Defense Production Act now. That's going on right now. That's a Trump administration call, which could be made even before they get in.
Heidi, I want to ask you about your other exclusive report. House Democrats issuing subpoenas for CDC and HHS documents about the pandemic response. Congressman Jim Clyburn saying the document shows some political motives. What can you tell us about what they're looking into, about those subpoenas, and how the CDC and HHS are responding here?
Right, Allison, they've been trying to get documents going all the way back to September. And now that what they have gotten, they say, shows a pattern of attempted interference by Trump political officials. They say specifically that there was attempts to alter or stop 13 different scientific reports, a lot of them related to these morbidity and mortality analyses, which are meant to inform the public about the impact of coronavirus, but also going all the way back, for instance, to the issue of hydroxychloroquine and its efficacy. As you remember, that was a drug that the president was touting as a miracle drug, which wound up actually being ineffective and in some cases even harmful. So the congressman is looking for more information to try and establish whether this interference was an attempt to further a policy of herd immunity, or whether it was simply to try and provide cover for a president who wanted to paper over how bad the coronavirus was really spreading in the U.S., Allison.
Heidi, a couple.
Okay, so that is the House is trying to have some oversight over what President Trump's administration did in response to the COVID-19 pandemic, especially early on when there was a lot of the president saying things that turned out not to be true, the hydrochloroquine and all those other things that were talked about early in the spring and in the summer and even into the fall. And basically they want to know, like she said, was this just mistakes, or was this the CDC and HHS, which is the Health and Human Services Department, trying to cover for the president who was making claims that weren't borne out in the science? And it's important that we have a good full accounting of this, even though President Trump is on his way out. We need to know what happened and if there's a way for us to prevent it from happening in the future, so that when another virus comes around, that we have this type of situation, that we have a better plan in place to make sure it doesn't impact us as much as it has. It's going to happen again, so we need to find a way to minimize the damage and learn the lessons that we should have learned from the SARS epidemic and whatnot that happened in Japan and China, and apply it to the next pandemic that happens after this one is resolved. Okay, so obviously that was the end. I'm sorry, that was the end of the report. But yeah, so this was basically twofold. They're looking at making sure that there's a good plan on distribution of the drugs, of the vaccine, and making sure that will the President Biden need to use the Defense Production Act to make it happen? He probably will at some point have to make it happen, either for the vaccine itself or for the syringes and needles to be able to distribute the vaccine. And hopefully at that point, we have a good plan in place to getting as many people vaccinated as possible, not just in this country, but around the world. So hopefully, I know this wasn't really a politician, but it had a really big, important policy conversation that I wanted to make sure that I got out to everybody. So hopefully, if you got something from this, you liked the video, and show me that you found it valuable. If you didn't, then obviously dislike. But either way, please comment below. And do you think that President-elect Biden should use the Defense Production Act when he becomes president in the end of January to ramp up production of either the vaccine or the syringes and needles? But until next time, I'll see you around the internet. You have a great day. Bye.